I'm here with one of my favorite people on the planet. This is Dr. Joe Bartges from the University of Georgia. Go Dogs!
Go Dogs!
Favorite people on the planet. This is Dr. Joe Bartges from the University of Georgia. Go Dogs!
Go Dogs.
He is an extraordinary person. He is an internal medicine specialist. He's a board-certified veterinary nutritionist. He sits with me also on the Association for Pet Obesity Prevention Board. Joe, it's a pleasure to be here.
It's good to see you.
Yeah. Well, listen, you've just been giving some outstanding presentations on pet obesity here at the first ever One Health Obesity Summit in Atlanta. No matter what veterinarians and pediatricians and physicians do, they've got to make sure they're connecting at an individual level with the patient or the pet owner.
Oh, I think that's true, not only with obesity, but with everything. I mean, it's got to be a very individualized approach to talking to them, managing things, what can they do. It doesn't do any good to recommend this diet that's a dry food if the cat won't eat dry food. It's a waste of time and a guaranteed failure.
That personalized, warm, compassionate approach, I think that is what has earned you all the accolades over your storied career.
I don't know if I've earned that many accolades, but it's just I've learned to do that over time. It just makes it more enjoyable for me, and I connect a lot with my clients.
It is so apparent how much you love being a veterinarian.
Right.
What do you think the secret is? What's driving you?
The chance to make a difference, and whether it's a difference with an individual pet or owner or both, or a chance to make a difference with a student or a veterinarian or the general public, or doing research which could change the way we're practicing veterinary medicine, is that being in that position to make, which gives you that rewarding feeling, but to make a difference and realize the legacy is what you've done to keep moving things forward.
Yeah, and you have certainly moved things forward. Now, you're a big part of this movement of One Health, which is integrating human and animal medicine. Tell us a little bit about what your objectives are with One Health.
Well, it's kind of interesting, sitting reflecting on when I was asked to give this talk at this meeting. About 14 or 15 years ago, I gave a talk at AVMA as part of One Medicine, and I don't even think it was called that then. I think it was like Global Health or something. But even back then, there was this idea, and as I thought about it, we've kind of put a name on it, but veterinarians do that anyway, whether it's from an infectious disease standpoint, or which is sort of where this began, but also from common disease entities. I mean, I got involved with doing research in urinary diseases, and got involved with working with urologists and because of that translational approach to things. So my view of the One Health thing is it's not a new concept, and it makes a whole lot of sense because we share the same environment. Rodent models are not what happened in the real world, but a dog who lives in the house with the owner and they both have the potential or actually have a similar disease tells you that there's other things we need to look at than just what's this level of this biomarker or what drug works. We need to look at what those environmental influences are, because we share those same things and we share so many diseases that are so common.
That's brilliant, and you need to listen to what this guy just said. If you had like one bit of advice to give to pet owners out there about, keeping their urinary tract healthy, or what would that one bit of advice on urinary tract health be?
1A is water. Improving fluid intake, improving urine output, keeping things flushed out. Cats normally urinate once every day, sometimes every other day. We want them to be able to flush these things out, whether it's crystals or infections or whatever it may be. And then the 1B part of that is any time you notice something wrong with your pet, they should be taken in. It shouldn't be ignored, like it'll go away in 3 or 4 weeks or months. You own a dog or cat that is at a high risk because they're a Dalmatian or they're a miniature Schnauzer or something, that those are ones you probably want to put the money and put the time and effort up front in catching it early or making sure they don't develop it before. It's easier to prevent than it is to treat.
Give me your best advice for pet owners out there to fight pet obesity.
Recognize it. I think that's the first and foremost and most important part, is looking at your pet, looking at yourself and saying, this is a problem. And it's not, you're not defined by that problem. you have or your pet has a condition, a disease, and this needs to be addressed from a controlled medical standpoint. It's the most common nutritional disease in dogs and cats and in humans, and the percentage of obese humans is about the same as the percentage of obese dogs and cats in the U.S. So it tells you it's more than just snacking, or it's genetics, or it's highly palatable food. I mean, there's so much commonality in this, that this is the purpose of this conference, is to look at what those are and how can we attack it for everybody's health.
Well, Dr. Joe Bartges, superstar, rock star, part of one of the reasons why the University of Georgia Veterinary School is the best in the
There
world.
You go. Go
so
dogs.
go dogs. Thank you so much. This is my favorite type of person on the planet. That is veterinary nurses or veterinary technicians. With me today is Miss Beckie Mossor. How are you doing?
I'm doing outstanding. How are you?
I'm great. You know how I feel about veterinary nurses, veterinary technicians. You are such an integral and important part of the healthcare team. What have you learned from a vet tech perspective about obesity and the One Health movement here?
I've learned actually so much. Number one, the statistics. And the statistics we're talking about here are terrifying. I mean, obesity is an epidemic. It's a disease, and we have to address it. We've got to change it. Veterinarian technicians have an opportunity here. We have education opportunities. We've got client bonding opportunities, and we have the opportunity to increase the human-animal bond just by helping them get their pets healthier. And I really felt like the human side was seeing, wow, this is the same epidemic on both ends, and we can address it, and we can actually increase our success by linking these together.
Yeah, word to doctors out there, it's the same problem.
Well, I think the fact that they have designated it as a disease, and I really think the veterinary industry needs to take a look at that as a role model and say, this is a disease. They're calling it a disease. It's a disease. And disease prevention is our job. And until we look at it as a disease, a precursor for diabetes, a precursor for osteoarthritis, precursors for long-term problems our pets are suffering with, it's a disease, and we've got to see it that way in the veterinary field.
And speaking of like getting the names right, I know that you are full on in the fight for changing the name of your profession. Tell me a little bit about your involvement.
So I currently serve as treasurer of the National Association of Veterinary Technicians. We are working really hard to make sure that the human side understands what we do so that they support us using the terminology of nurse. We're also spending a lot of time and energy making sure that this is what our profession wants, that this is really the best thing for our profession, so that we get the ability to get everyone out there, the public, recognizing our education, our abilities, and what we do in the veterinary community.
I really appreciate your efforts in trying to standardize the nomenclature, just like my fight for making obesity a disease. I mean, you're trying to help us understand what you do.
So I'm a master trainer with Canine Fit Club. Canine Fit Club is an initiative that brings people and their pets together in the gym and helps them address obesity, inactivity, and boredom in pets and people. So we're addressing these issues. We're helping to prevent, and we're helping to find solutions.
So Beckie works with Canine Fit Club, teaching people how to exercise with their pets safely and effectively. It's a wonderful motivational tool. It's something that I've worked with her for many years on, and it's really taken off. So if you haven't checked it out, Canine Fit Club, do yourself a favor and check it out.
Yeah. Start talking about it. It's hard to tell your owners your dog is overweight. It's hard to say. It's hard to say if you're overweight, and it's hard to say if they're overweight. Doesn't matter. This is a disease. We've got to talk about it, and we're going to give them more time with their pets because of it. Start talking to them.
This is why I love this lady. She's the best. Veterinary nurses, you rock. Thank you so much. Enjoyed. It's been a great, we're almost done.
Yeah,
So
almost done.
thank you.
Thanks.